everybody, it's Professor Miller. I just wanted to give you a brief introduction to Module 1, go over some of the content that I have posted within each section. Just because I have a lot of stuff posted here, and a lot of it is meant for resources to kind of guide you with certain areas that you can kind of look into. So I just don't want you to be overwhelmed with the amount of, files that are here. A lot of it is resources, and I'm going to try to, explain which each one is for, and the kind of the background with it. Our course is mainly forensics, from what I gather for this semester. However, we do have some nurse practitioner students that are joining us as well. You'll notice that I did add some more information, and a lot of it, I tried to put either forensics or NP students just to kind of guide you in your own specialty areas. However, like I mentioned before, advanced practice nursing in general, whether it's forensics or nurse practitioners, a lot of the concepts are very similar to each other, essentially. And the roles as a forensic advanced practice nurse and a nurse practitioner is very similar. And you have to look at a lot of these in the same context, but within your own specialty area. So even if the journal article is geared towards an NP or a CNS, you have to look at it within that forensics specialty area and think about your role and how it would fit into our healthcare system in advanced practice nursing. In general, I think a lot of people have already reviewed some of this or have looked into it at least. These are just general websites that you can browse and take a look at. And they're good sources to find further information. Kaiser Family Foundation, you'll find a ton of data out there. It's a great website to look at population health and our healthcare changes. Same thing with HHS. You can find numerous articles on healthcare reform, transformation, population health. Council of State Governments. This is another one too if you're looking at legislative matters. Population health once again, that's another one to kind of go to. Congress.gov is more at the federal level. So if you're looking at federal initiatives, that's a great site to go look through. Michigan legislature is obviously Michigan, so that's more of state. And I did add these two forensic specific, the AAFS 2016-17 legislative priorities. So this is actually a good resource for those forensic students that are looking into specific bills or policies that are kind of going on or that you should be advocating for. So it could give you that path towards your policy analysis. You may want to look through this and browse the topics because those would be some areas that you could think about doing for your policy analysis. I also did post this PDF file too to look at the economic impact of violence and abuse and looking at it from a systems perspective and the cost of healthcare, and the outcomes that it inflicts upon these populations. So it's a good resource to look at as well. We did have the course introduction forum. Obviously, that's still ongoing for your follow-up responses. So be sure to look in there and make sure you're replying and conversating with your peers, essentially. So from September 11th through the 24th is your first module, essentially. If you look at the course calendar, it is set up into weeks. However, like I said, it's really a module that modular approach that we take with this course. I always will put course material, and you always will find the page with your topics, readings, and assignments. So for Module 1, it's generally an introduction to APN health policy and political advocacy. So this is going to be your brief introduction to what we're kind of going to delve into within this course. So we're going to look at advocacy, we're going to look at that basic introduction to healthcare transformation, and then one of the biggest things I want you to understand with this module is understanding the difference between federal and state health policy differences there. Because you really do need to know, if you're advocating, you have to know where to go. You have to know whether it's a state issue or if it's even a county issue or a federal issue. So these are just some of the essential components that you have to have a good understanding of in order to effectively advocate for populations or health policy. And then we're also going to take a little general introduction at health policy and populations and general access to care. I always will put the Module 1 readings in here. Then at the bottom, you always will find our assignments with due dates. So your initial forum post for Module 1 is due on the 19th at midnight. Second postings are due by the 24th at midnight. So that's the completion of Module 1. I did want to run through some of these postings that I have up here so that you understand what to kind of look at and browse through. So this PowerPoint, the first one is Introduction to Healthcare Systems and Advanced Practice Nursing. Understanding what our healthcare system, that transformation that's occurring within our system, and looking at where we stand essentially. If you look at this PowerPoint video, it'll give you a great perspective on where we're lacking, especially looking at it from a global perspective with other nations and the differences there, and really how we really need to truly improve a whole lot with the amount that we spend on healthcare. It doesn't show what we spend essentially. Nursing truly is going to be transformational in our healthcare system and in the future. So our roles as nurses and advanced practice nurses is much different than it used to be. And, we need to be the leaders of our healthcare system. So this is a great PDF file to kind of look at, and it's just talking about leadership within nursing and how we kind of align with these changes that are occurring. The NGA paper is more geared towards the nurse practitioner students. However, like I mentioned, when you're reading these, even as a forensic student, you have to put yourself in that perspective of advanced practice nursing and look at it from that specialty area. So this is looking at primary care and the demand or need for advanced practice nurses due to the physician decline in practicing in primary care. You have to look at it from the same realm of forensics. There's not many, physicians that are going into death investigation or medical examiners. So your role as a forensic nurse is exactly what it should be going towards as a role of an NP in primary care. So you just got to put yourself in that perspective when you're reading a lot of these. Unfortunately, the literature is not out there yet because you guys are kind of the up and coming practice group. So you'll be the ones that are, showing these outcomes and how you fit into your specialty area. APR integration of improving care. It's kind of the same basis of this one too. This one kind of looks at all realms of APR in practice. It's at CRNA, it's clinical nurse specialist and NPs, and how really we need to be utilized more within our healthcare system. The next one is APRN policy paper from the Federal Trade Commission. They support our practice as nurse practitioners, so that's one to kind of take a look at as well. Advanced Practice Nursing Shaping Health Through Policy is an excellent article, and I recommend that you all read this one. Forensics, I did put this up here too. It looks at specifically at, this is from the Family Violence Prevention website, and it's looking mainly at the transformation that kind of went on with the ACA and its implications for women's healthcare and healthcare transformation within the field of forensics and violence and abuse. So those are good areas that you can kind of look at with, the specialty of forensics. The Intro to a Legislative Process, Citizens Guide to the State Government. This is just a good resource to have if you need to learn more about the legislative arena and how our state government essentially works. This file just discusses how a bill becomes a law. It's just a general overview, and then basics of reading a bill. That's another overview. These two books, these are books that I posted, and they have videos within them that are from the American Academy of Nurse Practitioners. Once again, forensic students, this applies to you as well. Learning that legislative process, who to communicate to or with, and how to go about it are all important factors for all of us advanced practice nurses. So these are two great areas to kind of look at and view the videos that are in there as well. And it does talk about how to contact your representatives. It gives you that general introduction because those will kind of help you with your further assignments within the course. The next section is populations and health disparities. KFF is at Kaiser Family Foundation, and it looks at disparities in care. So this is our vulnerable populations and how we need to be advocating for these populations and how advanced practice can make a significant impact on their care. This is another important article to look at, and I encourage all of you to read this one, Coverage Gap of Uninsured Adults. This goes into details about Medicaid recipients. As I mentioned in one of our forums, one of the questions is based on our federal initiatives and how the state can actually kind of impede upon our overall goals. And that goes both for our practice, because as you look into it more about NP practice or advanced nursing practice, every state has different requirements or restrictions to practice. So at the federal level, they may advocate for full advanced practice or no restrictions on practice. However, at the state level, it affects our practice and sometimes the restrictions, obviously. So you have to look at it from the practice perspective as well as looking at it from population health. As I mentioned, the federal level, the goal is to achieve Medicaid access to all recipients. However, at the state level, that's where it's actually initiated. That's not necessarily the case all the time. So you'll find that there's that gap of insured and uninsured adults and families, essentially. So take a look at this one because it'll help you kind of guide you with your answer to one of those questions. This I did just put up. It's about Henry Ford Hospital, and it was mainly to talk about populations and health disparities and the community need. When you open it, you'll take a look at it, and I wrote some notes in there as well, and you can kind of review that. But it was just an article that I thought tied in nicely with population health, health disparities, and making systems changes to help this population, essentially. These are all examples of federal and state policy. The main area that I want you to kind of get out of this is understanding the difference between state and federal policy. Because as I mentioned, you need to know where you're targeting when you're advocating for a certain policy, because some obviously are at the state level, some are at the federal level. This one is the APRN bill that was for nurse practitioners. So this is Michigan legislation, so you can look at this. Same thing with this one, it shows it moving through the system. This is the HB 5400, which was for nurse practitioners. This went through a couple of months ago. I put this up and it's for everybody to read just because obviously it shows you how the bill kind of progresses through our system. Each bill that you look up, it looks a little confusing because obviously there's tons of stuff on here, but you'll see that it's introduced to the House, then it gets passed to the House, then it goes to the Senate, and then it goes further, obviously. And the final step is it gets signed by the governor in the end. But, through the process of going through the Senate, the House, etc., sometimes the bills will actually change, as they move through. And sometimes it's a tedious process and it takes a while. So it's an important matter to kind of understand, too, because you have to know where you're trying to contact if you are trying to write a letter or advocate for the bill that you're looking at. So this was just an example of looking at a bill, and obviously you can always look up the complete document as well. And then I also have an example of a federal ruling for nurse practitioner practice too, and it was veterans access to care. So this was at the federal level, just to kind of give you that comparison between state and federal. For forensics, I did put up, this is a link, and it gives you some great areas to kind of look at for federal initiatives and kind of get you thinking about, an area that you want to look into or that you want to know more about. So this gives you some good ideas as to the initiatives that are out there. In terms of just for Michigan, I wanted to give you just how Michigan's doing. What's our status within the healthcare system? How are we progressing? So the Michigan Blueprint for Health is one of those resources that you can kind of look through. This is a very long document, but if there's a certain area that you want to look at, it's a great document to kind of refer back to. Michigan Healthcare Exchange, this is just through the ACA, and this is how, patients would sign up for healthcare through the ACA exchange, just so that you're familiar with it and you know what's on their site as well. These are other general resources that will be beneficial for future practice. The Legal Guide for Older Adults. This is mainly addressed towards the patient, but it's a good resource to have in case your patients are looking for other resources within the community. It's just a good document to kind of browse through. Same thing with the State Legislators Guide. This is very similar to your Citizens Guide to State Government. It just gives you, a general idea of how our government's set up and our legislators. So course activities, you always will find this at the bottom. That will be, the assignments for the module. So Module 1 discussion. So this is set up as a Q&A forum. So once you post your discussion response, then you can view your peers' response. So you must first post your response in order to review other posts. The initial response is due by September 19th at midnight, and then you'll have that follow-up posting from that point on until the 24th at midnight as well. Please review the discussion guide. There's a rubric on there on the main Moodle page, and you'll find that under that list that will have the policy analysis guide and all that. It's under that one little section up there. So for your follow-up postings, you could do two peer responses. Obviously, you can do more if you want to. You don't have to do 2 for each question, so just do 2 peer responses total. And as I said, our class is actually going to be pretty small. There's only, I believe there'll be like 12 or 13 of us. So, you feel free to keep that discussion going amongst your peers as well. So after you complete your readings and browsing through some of the articles, websites, then complete the following discussion questions. please post directly within the form. Don't put an attachment on there. It just makes it easier to read if you can even copy paste. If you write it, in Microsoft Word or Pages, then you can that way you have spell check and all that available, and you can post it within this discussion forum. So the first one, in your opinion, what are some of the forces driving health policy and the overall transformation within the U.S. healthcare system? So this is looking at it from a broad perspective. And it's your opinion. Like, what do you feel are these driving forces? And what are the keys to transformation with our healthcare system? Then, obviously, too, what are the main goals of transformation? And how does our practice as an APN align with this? So that could be specific to nurse practitioner or specific to forensics. How do we fit in with healthcare transformation, and how do we improve it, essentially? Number two, barriers at the state level can at times impede upon the success of federal initiatives, as I mentioned previously, and the overall improvement of population health. So I want you to kind of delve into that and look at state versus federal. How does it impede? And then based on your readings, what state level barriers can affect the overarching goals of healthcare transformation? So you need to have a good understanding what our transformation, what the goals are of it, essentially, how our practice aligns with it, and then what are some of those state barriers that can affect our transformation? And, looking back at some of those readings, that should help you answer this as well. Number three, how can APNs make a difference in the health of their patients and the public through active engagement in health policy? So this can be specific to your role as a forensic nurse or a nurse practitioner. Number four, in order to effectively engage in state and federal health policy issues, you need to be aware of who your elected officials are. So this essentially is just identifying, listing your state senator for your district, your state representative, and then your U.S. representative for the state of Michigan. So I want you to learn who your representatives are, and then I also want you to kind of look at the background a little bit. If you look them up, they'll give you the whole bio information on their websites, and it'll give you a general idea as whether or not they have any background in health policy, because many don't, and you'll find this out as you kind of look into this. So that's kind of the general question here. Who are they? Do they have a background in healthcare? If you go to the Michigan Nurses Association, there's actually a link through there, for advocacy, I think it's under, and you can look, it'll show you all the information. You can look up your zip code and all that, and it'll give you the information as to who your representatives are. But you'll find that a lot of times these, our legislators don't have a background in health policy or in the healthcare arena. So it's our job, as nurse practitioners or forensic nurses, to educate our legislators. It's critical in order to get things moving along. A lot of times they don't even know that there's an issue there, with a certain health issue or a population health issue unless it's pointed out to them. So it's very important for us to obviously get involved in health advocacy as well. So that's essentially, with number four, that's what I want you to kind of take a look at. And then obviously each one you can post with under each question for your answer. So that's a general intro to Module 1. So just kind of browse through these and it should help you answer a lot of the questions. And as I said, a lot of these are resources, or you can use them future in the course, like for our next module, because some of them apply to other areas as well. Going back up to the top, because I did add this stuff as well. This is your discussion forum guide. It's under the assignment guide. And then these are for our other assignments. I'm going to put up a WebEx that we can meet to go over the assignment or any questions you have on the course. And I believe I've only had a couple responses so far, but the survey is actually at the top right here, just for dates that we can meet. And it looks like it's probably going to be Tuesday evening, but I'll wait a few more days, basically tomorrow, to figure out if that's what works for everybody. Under here, I do try to put up legislative updates and other news. So throughout the semester, I'll start adding other, either websites, or it could be a file or a journal article that's interesting. So I'll put them up in this area. I do try to put some of the forensic specific stuff here, just some interesting articles to kind of take a look at and to kind of get you thinking on that leadership and systems change and our role as an advanced practice nurse within it. So if you have any further questions, obviously, please let me know. You can just post it in the discussion forum, the general forum at the top, or we will be meeting through WebEx, so you can obviously ask me at that point. And I'm looking forward to working with you all. So I will talk to you all soon. Thanks and have a great day. Bye-bye.